Hi, my name is Dr. Brian Shiple. I started my journey in regenerative medicine back around 2000. So my favorite conditions to treat that we get what I would say the biggest bang for the buck is in the spine. We developed treatment techniques by putting needles into our patients' discs using X-ray guidance. And we started with PRP, and then that went to bone marrow stem cells, and that has really made the big change. And now we have disc seal, and all of these treatments have a role in helping treat the spine, specifically the disc, and helping the disc heal when it's been irreparably damaged, and the standard of care is surgery. The other area of my practice that I live in is in the sports medicine world. And as a sports medicine specialist, I'm an expert in being able to evaluate patients' joints, their shoulders and knees and hips, etc., soft tissue injuries in ligaments and tendons, arthritic joints. And the regenerative medicine approach to that problem has advanced in great ways, lots of research, and using PRP, bone marrow stem cells, fat grafts, has really opened up a world where we can help a lot of our patients without surgery in the sports medicine world as well. My passion in this field comes from my ability to help patients. My wife says I jump out of bed in the morning and run to work, and that's because I enjoy helping my patients get better. For the chronic pain patient that has lost hope, that has seen dozens of doctors over many years, many of these patients have poured out their life savings to try to get better. Those patients are unique. I'm good at helping those patients, I think, because it all starts with the diagnosis. And so many patients have not been diagnosed properly, in my opinion. And what I do, I look at all their films. We have diagnostic ultrasound, MRIs, etc. I am a perfectionist when it comes to figuring out what the actual diagnosis is, and we have ways to prove that. And then we lay that out to the patient and we begin a treatment journey. And a lot of times it's not a one and done treatment. It could be a journey of several treatments, and almost like chipping away at an iceberg, where we finally get to the bottom and root cause, and the patient suddenly has dramatic improvement that they could not experience in the years before. And that is a very gratifying type of case to be able to help our patients with and help them get better where they had lost hope. In my practice, when we use our patients' own tissues to treat them, it gives us a toolbox to work with. For instance, their patient's own blood, we have PRP from that, we have platelet lysate, and we have alpha-2 macroglobulin. These are all terms that we can turn specific parts of our patient's blood into a treatment tool that addresses certain problems like nerve conditions, arthritis, torn connective tissue, etc. If the condition is too far gone, or the tears are bigger, or the arthritis is more advanced, we like to go stronger. And the stronger orthobiologic solutions we can offer our patients is bone marrow stem cells, where we take the patient's bone marrow comfortably from their backside, and we can process it and turn it into a concentrated stem cell solution. And we can inject that into joints, into ligaments and tendons, etc. We can put it in discs, and it helps our patients heal about 3 times more, in my opinion, compared to something like PRP. I have been at the forefront in the early days when regenerative medicine was just being coined regenerative medicine. My colleagues and I, we consider ourselves kind of the point of the spear. I've developed a lot of the treatment techniques with my colleagues over the years. I've lectured on this around the world, and it's an area of interest of mine. I'm really excited to be at IRM, Integrative Rehab Medicine. This is going to open up the most advanced regenerative medicine therapies to Southwest Florida. And in my Pennsylvania practice, we had many patients that traveled to my practice, and I expect that's going to continue to happen here in Southwest Florida. If you've lost hope with your orthopedic condition, I'd like to invite you to consider coming to Integrative Rehab Medicine, where we can help you with your chronic problem or your acute injury.